Okay, let's learn tetanus status. Now, this is a hard one to memorize, but I've made this little table here to simplify it, and this is based on up to date, okay? So this is the most literally up to date information that there is. So, first you need to know the tetanus vaccine is formally known as the toxoid, and the toxoid dose is 0.5 milliliters. The booster is formally known as the immunoglobulin, and the dose for that is 250 units. Okay, so we have the toxoid, which is a vaccine. We have the immunoglobulin, which is the booster. The other thing you need to know is the definition of vaccinated is 3 or more doses. Okay, so, and we do put a timeline on that, and it's a quite nice number, 10 years if it's a clean and minor wound, or 5 years if it's a larger, dirtier wound, okay? And that makes sense because why? Because we know that vaccines slowly lose their efficacy over time, okay? So the logic here, just think about this logically. I'm going to try and work through it. If a patient comes into the ED with a puncture wound and they're unvaccinated, what are you going to do? Vaccinate them, of course. So in that top row there of unvaccinated from left to right, you can see in all cases of an unvaccinated patient, give them the vaccine. The only case where they get a booster, in all of vaccinated or not, is if it's a larger, dirtier wound, okay? So if they're unvaccinated and it's a large, dirty wound, of course vaccinate them, but give them the booster as well. Now say they're vaccinated. Well, if it's a clean and minor wound, that's the whole point of the vaccine. They don't need a booster, they don't need a vaccine. But if it's been more than 10 years, sure, give them the vaccine, it'll help. If it's another wound, it's a larger, dirtier wound, we shorten that time frame to 5 years because, well, there's a higher risk and we need that efficacy there from the vaccine, so give them the vaccine. They don't need a booster though, they've already been vaccinated, okay? So screenshot this table, memorize the table, and just work through it with example patients. It's very logical. Just use your common sense, and you got this.